This is only one of the many protests taking place in front of children's hospitals across Quebec. Pediatricians are gathering to tell the provincial government that Bill 2 will make it harder for children to access care. The bill was passed under closure and is set to take effect in the new year.
This law is extremely punitive and people will leave.
Doctors say a key part of the law will assign patients according to their level of vulnerability, meaning that healthy children would fall lower on the priority list, and they say they could miss diagnoses.
This is a government that's lacking vision. We know that if we catch something early, we can make a tremendous difference in the path that these kids are going to have. These kids will have a chance to, we can pick up developmental delays, language delays, very vulnerable social situations, even physical diagnoses where picking it up, time is of the essence.
They're also saying that Bill 2's volume-driven targets are unattainable and that the care of a child differs from an adult's.
Investing in that time makes the entirety of the difference. You cannot be effective if you don't build a relationship and get buy-in. And this is not to mention the parents. Parents need explanations, reassurance, also, a clear understanding of what's happening.
They say Bill 2 will either have physicians move out of province or steer people away from the profession completely.
They want to get a residency position, but they're not putting Quebec residencies high up on their list, hoping that they match to another province.
We have to have basic liberties, basic human rights, basic decency, and respect for our work. We're well trained. We're bilingual or trilingual. And so job offers are coming in probably for every doctor here.
In a statement, a spokesperson for Quebec's health minister says Bill 2 will not negatively affect the physician's ability to provide care or the time to tend to complex follow-ups, adding that the minister understands the concerns and that's why he held webinars to clarify the bill. But for many, it's still unclear.
Healthcare is complicated, but I don't think that they've spoken to the right people to really understand how the care happens, how we care for patients in the real world. It's taking a very business approach to a very complex system.
Doctors continue to worry about the negative effects Bill 2 could pose. They say it will only create more holes in the healthcare system, and as a result, fewer physicians will work in the public sector or even stay in the province. But as it relates to pediatricians, their biggest worry is that the youngest part of the population will be neglected.